How is your wound doing so far? Much better, just a little bit sore around the incision, but I think it's healing. I wanted to make sure I'm doing everything right. How have you been caring for it at home? I've been keeping it dry and changing the dressing daily like you told me, but how do I know it's healing properly? There are 3 stages of wound healing. Inflammatory stage is where your skin is injured. The blood vessels around it narrow to stop more bleeding and allow a blood clot to form. Once a clot is formed, blood vessels expand to increase blood flow to the area. This brings white blood cells to remove dead tissue, bacteria, and nutrients to help the wound heal. Proliferation stage is where collagen starts to grow in the wound to increase the strength of the skin. This makes the edges of the wound shrink and close. More skin cells form new skin growth under the dried scab. Small blood vessels start to form around the area to increase blood flow to the new skin. Maturation stage is where blood supply to the area decreases and more collagen is added over time. With a large wound, this process can take months or years. If any of these processes are interrupted, the wound may not heal. What can slow down the healing process? Factors that can slow or stop the wound healing process include poor blood supply in those with diabetes, infection, dead skin, bleeding from the wound, further injury to the wound, poor diet such as lack of vitamin C, zinc, and protein, which are needed for wound healing, being elderly, smoking, wound dryness, poor immune system functioning, and lack of rest or sleep. So what can I do to help it heal faster? Take care of your wound and maintain a healthy lifestyle can assist the wound healing process. When taking care of your wound, wash your hands before you are changing the dressings. Use a suitable dressing for the type of wound you have. Avoid picking at healing area. Try to protect your wound from further damage. Watch the signs of infection and seek advice on what to do. Ask your doctor to review your medications as some can slow wound healing. Talk to your doctors about what you should take for pain. Stop smoking if you are a smoker. Keep your blood glucose levels well controlled if you have diabetes. Eat a healthy diet with plenty of fruits, vegetables for vitamin C, zinc, and protein, which helps to make collagen and support wound healing. Get plenty of rest, moving around, as exercise can increase blood flows and speed up healing. Got it. So I'm on the right track? You are. Just give it time. Healing isn't instant, it's a process, and every step counts. That was so helpful. Follow Celine the nurse to learn more about your health.